Hello guys, so now we shall be discussing about another nerve injury, and that is by name median nerve injury. Okay, so first of all we shall see how this median nerve is passing, and then later on we shall discuss the nerve injury upon that. Okay, so let us say that this is the lower end of the humerus. This is the lower end of the humerus, and all of you know, in this lower end, this one is called as the medial epicondyle. Medial epicondyle, and this one over here is called as a lateral epicondyle. Okay, one is called as a medial epicondyle and the other one is called as a lateral epicondyle. And all of you know that this region which I am shading right now, this is above these two condyles. That is why this region is called as a supracondylar region. Okay, so actually your median nerve passes from this supracondylar region itself. Okay, so this median nerve passes exactly from the supracondylar region down. Okay, so it passes down all the way, and all of you know the median nerve is passing along the supracondylar region all the way down till here. And here what do you have? You have got carpal bones, you remember, right? Here you have got carpal bones 1, 2, 3 and 4, 5, 6, 7 as well as 8. And on the surface of carpal bones you have got something called as flexor retinaculum. This is called as your flexor retinaculum, right? And this median nerve passes beneath the flexor retinaculum and enters into your palm. It passes beneath the flexor retinaculum. That green color layer is called as flexor retinaculum. It passes below that flexor retinaculum and then enters into the palm. Now after entering into the palm, what will happen to the median nerve is, first median nerve will supply your thenars. Okay, remember one thing, it does not supply all of your thenars. The median nerve supplies, if there are 4 thenars, it will supply 3 thenars only. Okay, it will supply all the thenars except adductor pollicis, क्योंकि adductor pollicis is supplied by ulnar nerve. So median nerve is coming like this, passing beneath the flexor retinaculum, entering into your palm. First it supplies your thenars except adductor pollicis. उसके बाद it will supply your first lumbrical, it will supply your second lumbrical. Okay, then third and fourth are supplied by ulnar nerve. Okay, now so the median nerve is coming, passing below like this, and as I already told you, once it enters here, it will start giving branches. The first branch, so it will make a turn like this. Okay, now in this turn, what will happen is that it gives out its first branch. It gives out its first branch, and these branches are supplying to the thenar muscles. So it supplies your all thenars except adductor pollicis. Except adductor pollicis. Now after this, you have got a next branch like this, right? Now this second branch supplies your lumbricals. Now in these lumbricals, what are the lumbricals? The first lumbrical as well as the second. Okay, not third and fourth, because third and fourth are supplied by ulnar nerve. Okay, and finally here it gives one more last branch, and this branch is a special branch, and this is called as a digital branch. Digital branch. What do I mean by digital branch? Digit matlab kya? Digits. Okay, so this digital branch supplies to your digits here. Okay, it supplies to the fingers here. Clear all of you? It supplies to the tips of your fingers. Okay, it gives sensation to the tips of your fingers, right? Now next important thing is that there is one branch of this median nerve, see, that is coming, that is passing above. You see, that is passing above what? It is passing above your flexor retinaculum and entering into the palm. So previously this median nerve passed below the flexor retinaculum. Now this branch is passing above the flexor retinaculum. Now why this is very important is that, for example, if there is any injury at the flexor retinaculum region, what are the things that will affect? Median nerve will be affected, right? And the first branch will be affected, second branch will be affected, third branch will be affected. But do you think this fourth branch will be affected? No. Why? Because this fourth branch is passing above the flexor retinaculum, so there are no chances that this could be affected. So it passes above here and supplies the skin sensation on the palmar region. That is why it is called as palmar cutaneous branch of median nerve. Okay, so this is called as palmar cutaneous branch, which supplies the skin sensation on the palmar region, and digital branch supplies the sensation on the digits of first 3 fingers only. Okay, not the last 2 fingers, it supplies only these 3. Right. What are the important things we can discuss here? Yes, important things which we can discuss here are, the first important thing is that here this median nerve gives out a branch. There is one small branch of median nerve that is coming out, and this nerve is called as anterior interosseous nerve. So a branch of radial nerve is called posterior interosseous nerve, which is responsible for finger drop. You remember? Now here a branch of median nerve is called as anterior interosseous nerve. So anterior interosseous nerve, where does it supply? So to first of all understand where does it supply, first of all we should know one important thing, that what are the muscles that median nerve is supplying. See here now, you know your forearm, right? Your forearm is mainly divided into 2 compartments. What are those 2 compartments? One is called as the anterior compartment, one is called as a posterior compartment, right? Anterior compartment is also called as a flexor compartment. Now within this anterior or flexor compartment, there are 2 things again. One is called as the superficial compartment, another one is called as the deep compartment. Okay. Now in superficial compartment, I want you to remember the muscles by a mnemonic PF, PF and PF. Okay. So the first muscle is pronator teres. Okay. The second muscle is flexor carpi radialis. Flexor carpi radialis. उसके बाद P stands for palmaris longus. Palmaris longus. And F stands for flexor carpi radialis हो गया, अभी flexor carpi ulnaris. Flexor carpi ulnaris. Okay. Next P stands for pronator quadratus. Pronator quadratus. And next F here stands for flexor pollicis longus. Okay. Apart from this, there are 2 more muscles which you need to remember. One is called as flexor digitorum superficialis, flexor digitorum profundus. Okay. So these are the muscles which I want you to remember. Now out of all these, remember one very important thing. All these muscles which I have told you are innervated by median nerve except 1.5 muscle. Okay. So let us write those things. So here all are innervated by median nerve except 1.5 muscle. Okay. Now what is that 1 muscle and what is that half muscle? So this 1 muscle is flexor carpi ulnaris. ये वाला flexor carpi ulnaris, and that half muscle is the medial half of flexor digitorum profundus. So medial half of flexor digitorum profundus. Okay, you see this is the flexor digitorum profundus here. This muscle is divided into 2 parts, medial half and lateral half. So who is supplying this flexor carpi ulnaris and medial half of flexor digitorum profundus? They both are supplied by ulnar nerve. They both are supplied by ulnar nerve. Okay, they both are supplied by ulnar nerve. So now let us enter into the topic. Anterior interosseous nerve mainly supplies your pronator quadratus, flexor pollicis longus and FDP. So these 3 muscles are innervated by a branch of median nerve, that is anterior interosseous nerve. So anterior interosseous nerve supplies your pronator quadratus, right? It also supplies flexor pollicis longus, and it also supplies lateral half of FDP. Lateral of क्यों? क्योंकि medial half is supplied by ulnar nerve. Now lateral half is supplied by median nerve. Median nerve मतलब वही, there is a branch of median nerve, that is anterior interosseous nerve, so that will supply. Then what about the medial half? I just told you it is supplied by, medial half is supplied by ulnar nerve. Here, medial half of FDP is supplied by ulnar nerve, right? So these are the three important things I want you to remember. Okay, these are the three important things I want you to remember. Apart from this, just remember another branch also. What is that another branch? It also gives innervation to another branch called as flexor digitorum superficialis. Okay, then obviously flexor digitorum superficialis and remaining all these are innervated by median nerve only. So purely FDS is innervated by median nerve. Okay, now here comes the clinical points. Okay, and one more important thing I forgot to tell you, that there is a muscle. Okay, let us push all these things down so that, let me put it here. Yeah, so there is one more muscle, guys, and this muscle starts from the medial epicondyle. See, this is the muscle like this. Okay, and this muscle, okay, let me put this thing also down. Yeah, so here there is one more muscle like this, and this muscle is starting from the medial epicondyle. Now all of you should pay attention to this muscle over here. Now this muscle is having a small opening in the center, and through this opening you see a nerve that is passing, right? This nerve is median nerve, and this muscle is pronator teres muscle. I hope we discussed it already, right? Pronator teres, see, we have written it already, right? So through the heads of pronator teres, you see a muscle that is passing, a nerve that is passing down, and that is your median nerve. Now, after this, I hope you understood this. After this, let us discuss at which areas the median nerve can be damaged. First important thing. देखो, there can be a fracture at the supracondylar region, है ना? अगर supracondylar region के पास fracture हुआ, then median nerve will be damaged. Second thing, there can be compression of this muscle pronator teres, right? So let us say this is the first point, and this is the second important point, that pronator teres muscle compression can also lead to median nerve injury. Third important thing is there can be injury only to anterior interosseous nerve separately, right? Fourth important thing is there can be some kind of problem near the flexor retinaculum, I mean near the wrist region. Okay, the only problem in the wrist region which you see is carpal tunnel syndrome. Okay, so, but by the way, as we have already numbered it, these four scenarios we shall write one by one. Now, scenario number one. Now, all of you look here. Even in first case, or even in first case, or even in fourth case, okay, agar in first case if there is supracondylar fracture, the nerve below the fracture, all the nerve below the fracture, it won't work. Yes or no? If it is not working, it means the Thenars except adductor pollicis is also not working. First two lumbricals are also not working, right? And digital branch is also not working, and palmar cutaneous branch is also not working. It means anything which is present in the hand is also not working. Yes or no? Not only that, anterior interosseous nerve is not working, and nerve supply to FDS is also not working. When there is an injury at the level of A, 0.1, okay, वहां पे अगर इंजुरी हुआ तो नीचे का component जो है that will not work at all. You know this. But we are only concerned about the thenar region now. Okay. For example, if there is an injury at the level of 0.1, so what will happen? Will the thenar muscles work? No. If thenar muscles are not working, that would lead to a deformity called ape thumb deformity, where the patient's hand will be like this. Okay, this is called as an ape thumb. Okay, the thumb is adducted like this. It will be all the way like this, looking towards you. So this is an ape thumb deformity. Even if I am closing the fingers, the thumb cannot be flexed or closed. So this is called as ape thumb deformity. So one thing you need to be clear is that ape thumb deformity will happen even if there is an injury at the level of 0.1, or even if there is an injury at the level of 0.4. Yes or no? So even at the level of 1 or even at the level of 4, you will have ape thumb deformity. Ape thumb deformity. Okay. Now, after this ape-thumb deformity, the second important thing which you need to see. So, let us see what are the things that can happen only at the wrist region. Only at the elbow region. Okay. So, point 1, that is at the elbow. Point 1 is at the level of elbow. Okay. So, at the level of elbow, what can happen? For example, if there is a injury at the level of elbow, that can be mostly supracondylar fracture. Let us write it as supracondylar fracture. Supracondylar fracture. So, if there is an injury at the supracondylar fracture, now tell me what will happen. This patient will come to me with ape-thumb deformity. So, he is coming to me, doctor, my finger is like this. Okay. Now, I will, the two things will come into my mind. Maybe the injury can be at the level of supracondylar region, or maybe the injury can be at the level of wrist. But I don't know where is the injury, right? So, for example, he did not get any X-ray near me. If he did not get any X-ray near me, obviously I won't even be knowing that he is having supracondylar fracture. Now, there are two questions. Injury might be here or injury might be at the wrist. So, to find it out, what I will do is that patient with an ape-thumb deformity, I will tell him to bend his fingers, right? Now, I have ape-thumb deformity. If you tell me to bend my fingers, then I will bend my fingers, right? Now, how am I bending my fingers? I am bending my fingers with the help of two muscles. One muscle is called as flexor digitorum superficialis and flexor digitorum profundus. With the help of these two muscles, I am able to bend my fingers. If I am able to bend my fingers, इसका मतलब क्या है? Then injury did not happen to FDS, injury did not happen to FDP. If injury did not happen here, it means injury did not happen at the level of point 1. It means injury happened at the wrist, at the level of 0.4. That is the reason why only and only ape-thumb deformity is seen, right? There is no problem in the flexion. You're clear with this? Second important thing is that if the patient is having injury at the level of elbow, right, obviously he will have ape-thumb deformity. So he will come to me and put his finger like this, and I will tell him to bend his fingers. Now when I will tell him to bend his fingers, see, he is having now injury at level of 0.1, right, supracondylar fracture. FDS is gone, FDP is also gone. If I tell him to bend, can he bend? He cannot bend, right? He will try to bend, but he cannot bend. But remember one thing, FDS is completely gone, so he cannot bend. But in FDP, only lateral half is supplied by median nerve. Okay, medial half is normal क्योंकि medial half is supplied by ulnar nerve. Okay, medial half is supplied by ulnar nerve, and ulnar nerve is not damaged here, only median nerve is damaged. So this is the medial part. Okay, this part is the medial part, this part is the radial part, the lateral part, medial and lateral. So which is working now, medial or lateral? Medial is working, lateral is not working here. You see, lateral is not working. So if I tell the patient to bend his fingers, medial is working, so he will bend his 2 fingers or maybe 2.5, 3 like this, but he won't be able to bend these fingers completely. Okay, why? Because lateral half of FDP has stopped working. So this kind of deformity is called as pointing finger deformity. Okay, to explain this, I've given such a long explanation, but still it is worth it. So this kind of deformity is called as pointing finger deformity. So in the point at the level of elbow, what are the things you see? First thing, what you see? Ape-thumb deformity, write it down. Ape-thumb is common everywhere, right? Along with ape-thumb deformity, you also see pointing finger deformity. You see pointing finger deformity. Clear? After at the level of elbow, now the next we shall discuss is at the level of wrist. Okay, so at the level of wrist, what will happen? At the level of wrist also ape-thumb is there? Yes, at the level of wrist also you see ape-thumb deformity. Okay, but will you see pointing finger? No, क्योंकि अगर injury is at the level of wrist at level of 0.4, है ना? FDS is not affected, lateral half of FDP is not affected, so they are fine, right? So what you need to do? You have to write it as there is no pointing finger deformity. No pointing finger deformity. No pointing finger deformity. Not only that, you should know if there is injury at the level of wrist, what is the problem? This problem you call it as carpal tunnel syndrome. Carpal tunnel syndrome. So if a patient is having injury at the level of carpal tunnel syndrome, what will happen? What will happen is that anything that is passing below the tunnel will be affected, but anything that is passing above the tunnel will not be affected. So what are the things that are passing below the tunnel? Thenar except adductor pollicis, first to lumbricals and digital branch. So patient will complain of pain and tingling sensation in the first three fingers. Okay, he will not complain pain and sensation in the last two, because last two is supplied by ulnar nerve here, right? So in the first three fingers only. And you ask the patient, do you feel any sensation here? He will tell yes. Why? Because palmar cutaneous branch is intact. Kyun? Because it is passing above the flexor retinaculum. Okay, so palmar cutaneous branch is not affected here. So remember one thing, in carpal tunnel syndrome, the palmar cutaneous branch is not affected. Palmar cutaneous branch is not affected. Next important thing, we have discussed injury at the level of elbow. We have discussed injury at the level of wrist. Now we will discuss injury at the level of point number 3. What is point number 3? That is anterior interosseous nerve. So anterior interosseous nerve injury. So this is called as isolated interosseous nerve injury. Now, all of you guys, how do you tell an okay? This is how you tell an okay. For example, if you won't tell okay like this, right? You will tell okay in this way. If you wanted to tell okay like this, what are the muscles you need? First of all, you have to put your hand like this. To put your hand like this, this condition, this way of putting your hand is called pronation. Okay, this is called supination. This is called as pronation. So first I will put my hand in a pronation way, right? This is called as pronator quadratus, which is responsible for putting my hand in pronation. Then my thumb should be flexed like this. So flexion of my thumb is happening because of flexor pollicis longus. My finger also should flex like this, my index finger. This finger, index finger is flexing because of flexor digitorum profundus. Okay, so 3 important muscles that are needed here. What are those 3 important muscles? Pronator quadratus for pronation, flexor pollicis longus. Flexor pollicis matlab kya? Pollicis, right? Longus is responsible for flexion of thumb, and lateral half of FDP is responsible for the flexion of the lateral half of my index finger. Okay, so together I can make an OK sign. Agar anterior interosseous nerve damage hua, then can I make an OK sign? No. What will happen? I cannot pronate, I cannot flex. Instead of flexion, there will be extension. Instead of flexion of lateral half of FDP, there is extension of lateral half of FDP. So if I put my finger like this, this is the sign which I can make. This is called as collapsed OK sign. Okay, so all of you have to remember, anterior interosseous nerve injury will cause collapsed OK sign. Okay, anterior interosseous nerve injury will cause collapsed OK sign. So what are the important things you see? Let us write down what are the cases how there can be injury here. The first important case which you can see here is injury at the level of supracondylar region, that is supracondylar fracture. Supracondylar fracture. Second important thing is injury can be at the level of pronator teres also. Compression, contraction of pronator teres, that would lead to damage to the median nerve. This is called as pronator teres syndrome. Pronator teres syndrome. And third important thing is that there can be injury at the level of wrist, that is called as carpal tunnel syndrome. And finally, there can be isolated nerve injury, that is anterior interosseous nerve injury. Okay, so these are the places where you can see the injury to what? the median nerve, injury to the median nerve. Okay, so these are the conditions which you see. Clear?